My name is Dr. Ashlee Erskine, and in today's episode of Practice Essentials, I will be discussing outpatient hospital discharge follow-up visits. There are an estimated 35 million hospital discharges each year in the United States. While hospitalizations are a costly component of the healthcare system, hospital readmissions have significant financial implications as well. It's important to note that the U.S. Hospital Readmissions and Reduction Program charges financial penalties for hospital readmissions of Medicare patients in an effort to reduce avoidable readmissions. The outpatient care that your patients receive after hospital discharge can reduce the rate of readmissions and can have significant impact on your patient's health outcomes and experiences. The question before us is, how can we minimize hospital readmissions for our patients? It's a fact that follow-up visits can reduce readmissions, especially when completed within 7 to 14 days of discharge. It's also important to note that most patients age 65 and over do not understand changes to their medication regimen on discharge. The hospital discharge visit is the perfect opportunity to correct any medication issues and to make any necessary early adjustments to medications for these high-risk patients. Our staff reminds patients to bring their current medication bottles with them to the visit for an accurate medication reconciliation. In addition, the hospital discharge visit enables the provider to follow up on any pending or incomplete studies, reevaluate the patient's status, and arrange for next steps in the patient's continuum of care. It is essential for your office to have a system in place to identify recently discharged patients and to contact them as soon as possible. We suggest utilizing a team-based care approach in which support staff follow a standardized workflow to identify recently discharged patients and reach out to them within 2 to 3 days of discharge. Our support staff also obtains any necessary hospital records prior to the appointment date, allowing for record review and minimizing any potential delays in care. In addition, it is important to maintain open slots in your schedule to allow for these appointments to be made within the 7 to 14-day timeframe. It must be emphasized that an essential component of this visit is patient education, and this is your opportunity to help your patients get back on the right track. And finally, consider a telehealth visit for patients who may be challenged getting into your office. Regardless of how you incorporate the discharge follow-up into your practice, taking the steps to make this a consistent process for high-risk, recently discharged patients will make a great difference for both your patients and your practice.